Welcome to the next episode of Questions People Ask. We're here today with Dr. Sachin Shah. He's a professor of pharmacy at the Thomas J. Long School of Pharmacy, University of the Pacific, and co-founder of Pill Clarity. Welcome, Dr. Shah.
Thank you, Dr. Commins. Pleasure to be here.
Could you sort of start by telling us a little bit about yourself and how you ended up as a pharmacy professor?
I don't think you want to go too far back, but yeah, I was originally from East Africa, Tanzania, and then came to Boston for my pharmacy school. So I did a 6-year Doctor of Pharmacy program there in Boston at Massachusetts College of Pharmacy. After that, I did a 2-year cardiovascular research fellowship at UConn. So you would imagine that after that, doing cardiovascular research was an area of passion for me. So I ended up at the University of the Pacific in California, like you mentioned in the introduction. For the last 17 years, I've been deep diving into cardiovascular research, dietary supplement research, some device research, all sorts of things. And fortunately, I have some military colleagues out of Travis Air Force Base who I partner up with to do some of this. So I'm grateful for that collaboration as well. But yeah, that's kind of my brief bio, pharmacist by background, but researcher at heart.
We'll talk about Pill Clarity. But you, in an academic setting, you probably have multiple different roles. What are some of the roles that compromise your day-to-day or week-to-week existence?
Well, there's and you understand this well. There's the classic, teaching component of any academician out there. So I do that. I take students on clinical rotations. But outside of that, I run a fellowship program that is partnered with multiple pharma companies, and we're training people to be clinical scientists or doing medical affairs and medical information. So all sorts of different roles that pharmacists can play in pharma. So we have about 6 partners, about 10 fellows. So I kind of oversee that fellowship program. And then, of course, I have a research lab called ICOR, which stands for Innovative Clinical and Outcomes Research. So we try and do clinical trials that are of smaller but rapid deployment kind of a capacity. So pharmacy students can get exposure to early trial design and execution. So do that as well. And those are at least 2 of the big hats that I wear on top of the academic teaching.
Ah, wow. Yeah. So as with many people in academia, you're a busy guy.
It's fun and it's passion.
Absolutely. Well, if you don't mind, I think we'd be interested to hear how Pill Clarity as it currently exists came into being. Walk us through that, if you would.
Yeah, that's a question near and dear to me and close to my heart, pun intended, being my cardiovascular background. But, I just care. That's kind of me, and I care a lot about people. So even in my research, many moons ago, we started doing research on energy drinks and the cardiovascular safety around them. And what are the ingredients in them that, may be concerning? Similarly, we heard about long COVID, and many of these patients were getting ignored. So we did research around that and how do we help these people get better. So Pill Clarity was a genesis of that problem, which is I care. And we knew that it was a good subset of people out there who wanted to know the exact ingredients of their medications. Maybe that is because of their religious or dietary preferences, or they have a true, allergy-based reason to not consume certain ingredients in medications. So it really started with a patient problem that came my way. They wanted to know what was in their Prozac, I believe it was the drug, the first one that I encountered. It took me 8 hours to figure it out. And I'm like, this is not practical. Patients should not have to skip their medications for this type of a problem. And that was history. Now we're helping thousands of patients. And we are where we are.
Wow. Yeah. And Pill Clarity, I assume, had some iterations prior, right? We don't always launch in final form.
Yeah. So we were actually previously, as you very well know, we're called Vegan Med because we thought it's going to be all the folks that are vegan who care about this problem. So that was one version. We thought that we could create an automated program that would solve this problem. And we realized we cannot do that because the pharma disclosures for some ingredients like magnesium stearate can be plant or animal. So you just never know. And you cannot just write code to solve this problem. I went to the FDA and said, we filed a citizen petition and said, can you make this a requirement so vegan med or pill clarity is not needed and the world is a better place? And it's been a year and a half and that has not happened. So now currently we have landed to, after a few iterations, a website where people have free access to over-the-counter products directly on the website. And then, of course, we run a medical information center where people can reach out to us with anywhere from 1 to 37 meds is the highest we have gotten, and we help them. And it's fun. The 37 patient medication patient, we were able to help them in under 30 minutes, and that was very rewarding and shows efficiency. So that's the current version right now.
Wow, yeah, that's incredible. There's two things I wanted to pick up from that answer, and the first of which is, do you have a sense that, aside from the citizens petition that y'all filed, do you think action is coming to change this from a federal level, or are we kind of where we are for the foreseeable future?
I'm an optimist, so I hope that action is coming. Second, I don't intend to give up in trying to help patients, so we're not going to go away. These patients are not going away. As you very well know, you're a founder in this space and an innovator in this space. We have about 500,000 people with alpha-gal syndrome who absolutely need this information. And there's some data that says that there's 33 million people out there with food allergies, right? The top 9 food allergens. So these people need this information. The numbers are not small. So I think we're making progress, not fast enough, but I'm an optimist and I think that it will come. That being said, I think a lot more awareness is needed. Your data showed the number of providers that are not aware of this condition. So I think a lot more noise needs to be made. A lot of awareness is needed for that action to come. But yes, it has been a tough road. I do not want to discount what you're saying. It has been a tough road. But I believe that, just like the moon that never stays hidden too long, the truth will come out and patients will get what they need.
I guess in some ways, kind of akin to oncologists, right? You'd be happy to not have to do that role if there was enough transparency.
Yeah. So, on that front, like dye-free medications, as Secretary Kennedy has made that an issue, a national issue about not having petroleum-based dyes in their medications. So we're doing that as well now. For example, you can take the classic example of Viagra, which is known as the blue pill. And has blue dye in it, but now there are generics available that don't have blue dye in it. So now we can tell people which same active ingredient they can take without that dye. So to your question, if there's progress made on transparency on the dyes, I believe it ties to the progress being made on the ingredient transparency as a whole.
Do you find that there is a difference in when y'all make contact with a manufacturer and it's a generic versus a name brand? Is there a difference in the information that they're willing to give, or the clarity of the information from those sources?
There's multiple answers to that. The short answer is it's incredibly variable. Okay. This is some unpublished data that I'm sharing with you for the first time. We did a mini project where we reached out to the top 200 drug manufacturers, which came to about 100 and something manufacturers. The top 200 drugs, 100 and something manufacturers. And we found that 50% of the time, we didn't even get an adequate response. And we were asking this over 3 weeks in written form. So the system is broken. Many of them don't even have contact information on their website. So that's a problem. And patients don't know that I'm not looking for any contact information. I'm looking for the medical information department. And then there is other data on the accuracy of the medical information department as a whole that says that 40% of the time you will not get an adequate answer, and you have to kind of dig a little bit deeper. So unfortunately, the answers are all over the place. And to give you a very specific example, I had a patient just last week who asked us about a proton pump inhibitor that is available over the counter from a pretty significant company. And we got a response that says that the PPI did not contain any animal-derived ingredients. And our pharmacist checked the packaging and the ingredients, and it said gelatin in there. And that made no sense. Coincidentally, the patient also checked with the manufacturer, and they got the same response saying there's no animal-derived ingredients. So we have two sources of information, but that's why our pharmacists needed to do their due diligence. And this ingredient was gelatin. And as you know, this was a patient with alpha-gal syndrome. That can be a problem. So, unfortunately, multiple steps of verification are needed. We need third-party verification, which is where some of our work comes in. But the answers are all over the place.
So are y'all in the testing business? Yeah, intrigued me by that.
Yeah, that's an intriguing question. That's part of the iteration that we went through. We started thinking that we should just test for this, and the problem will be solved. We learned over time that oftentimes the molecule alpha-gal, galactose, alpha-1 galactose, gets denatured enough that you can't pick it up on the lab test, but the patient is still reacting. So, unfortunately, lab testing may not be the solution as a widespread, algorithm. So we're not in the lab testing space right now. No.
I mean, we've tried some of this too, and it is not straightforward with alpha-gal. I think your experience mirrors ours. Is AGS the most common reason why folks are reaching out or contacting Pill Clarity?
Yes. I would say 80+%, I would say more than 90% maybe, patients are alpha-gal patients. It is life-saving, right, for these people. So majority of the patients are alpha-gal syndrome patients.
And obviously medications are a big part of this, but y'all do more than just have, I assume, field questions beyond just medications, right? There are personal care products.
So yeah. So
didn't intend to get into that, right? How did that happen?
Necessity, right? Necessity. So we started getting questions, not just from the United States, by the way, from all over the world as well. We're getting questions, primarily United States. But then people will just ask us saying, hey, look, here are my prescription products. Can you also help me with these over-the-counter products? And we know that sometimes they can look it up themselves. But, a common question we get is just, what is gelatin? So when people don't know that, it makes sense for us to take care of the over-the-counter products as well. And personal care products, because people were reacting to things like feminine pads and things that could be in there. Band-Aids can sometimes have products that they can react to. So we had to expand beyond just tablets and pills and pharmaceutical products. So right now we have over 1,500 over-the-counter products that can be supplements, personal care products, or over-the-counter kind of like Benadryl products on our website, and that's all open sourced. And of course, for prescriptions, we give personalized responses to people. But the answer is necessity. People were asking us. We didn't want to leave that gap and leave them incomplete, because when you go to a restaurant, you need everything else along with your primary meal to consume your meal. You need the fork, you need the knife, and you need sometimes the dessert as well. So people live with prescription meds and also personal care products.
Yeah, it's a good analogy. Well, can you describe what the workflow is like on your end when someone submits, typically right through your website, correct? And they may say, like, as you give the example of a PPI, I need a PPI that's safe for me. I have alpha-gal syndrome. And then how do y'all take it from there?
First off, on the landing page, it's very easy. They do the button Ask a Pharmacist. What is important, whether it's a provider or a patient, because we have both sides reaching out to us, is they try and give us the specific medication that they are looking for. So they cannot say, just give me a pain medication. That is not something that we're going to respond to. And we'll ask them, what specific medication are you looking at? So we want the name, the brand or the generic name of the medication. After that, if they do have it, we want the specific NDC, which is the national drug code. If they have it, that helps us a lot because it helps us identify the exact medication. And then the other critical piece of information is, why are they asking us? Do they have alpha-gal syndrome?
Yeah.
Do they have other allergies like carrageenan that they may be reacting to? Not everybody reacts to carrageenan. Some do. Or is it a dye? Like a lot of moms are asking us about certain dyes. Or is it, just for other, dietary or religious reasons? The answer changes based on why they're asking. But like I said, it's majority alpha-gal syndrome patients. Now to answer the latter half of your question, which is, what does the process look like on our end? So we are doing the heavy lifting that often patients have to do, providers have to do, or pharmacies have to do by reaching out to the pharmaceutical company and getting the answer from them. And we're doing this very frequently. Second is, we know how to, and we get this response in writing, so it's not verbal. So it's written and documented. And that's a big differentiator. Third, we do our own pharmacist check, like the example that I gave of the PPI, that even if what the pharmaceutical company may say, we're using our own kind of algorithm to make sure that everything is checked out. And then we're giving patients a standard response letter saying, hey, for this one drug, like levothyroxine, which is the number one drug that we get asked about, here are all your options with the different manufacturers. And that's how we're responding to them. The next layer of service is we're actually collaborating with pharma. And a good example is a company called SC Pharma. They make furosemide. The branded name is Furosix. And we have collaborated with them in an official capacity where they give us information on every single ingredient. And if it's a device, the device ingredients as well. If it has a little injector and infuser with it, then they tell us about that. And that is the gold standard way of doing it. And we're starting to form more and more of those collaborations. Beyond that, we are now working with companies to kind of provide a certification seal as well. For example, we have a Benadryl, generic name being diphenhydramine, that is certified by us. So we know that manufacturer fully understands the process. They will not be changing out suppliers, and they will always be making sure that ingredients do not have animal-derived ingredients in them. So those are just the different methods we kind of go into. But the primary one is engaging with pharma to make sure that the answer is accurate.
You mentioned that levothyroxine is the number one question. I'm assuming from the alpha-gal allergic patients.
Yes.
What would be the next couple?
So cetrizine, which makes a lot of sense, is another one. We do get some antibiotics as well. Believe it or not, we get the calcium and vitamin D question as well. But the ones that they use most frequently, antihistamine, corticosteroids, make a lot of sense. So we do get those. We get some cardiac drugs as well. It is a function of just the conditions that people have in society as a whole. So the top 200 drugs, most utilized in the country, we do get hit on them quite a bit.
That makes sense, as you said, the common things being common. As you described the workflow on the pill clarity side, it's a tremendous amount of details. I mean, you must be very busy fielding. How big is your team at this point? And, what does that look like in the future?
We are not big enough because as you can imagine, we do get a lot of questions. We get about 1,000 questions, anywhere from 1 to 37 meds at a time, like I said. So we're low resourced, and, we have generous patient support that kind of helps fund some of this as well. But we're a team of 2 pharmacists and some interns and some non-paid volunteers. But full time, we have 2 pharmacists working on this in addition to myself.
Wow.
We're hoping to grow over time, but we're not there yet.
So if people feel compelled, would like to support the great work that y'all are doing,
Mm-hmm.
Are there ways in which they can do that?
Yes, Pill Clarity Foundation is the website, and we would be most grateful for people's contributions. Scott, to be honest, many people tell me that I should just charge patients for our services, but there's something just morally, I feel like patients deserve to know what's in their M&Ms and what's in their medications at no additional cost. So for as long as my academic heart can continue to keep the service open, we're going to try and do that. But thank you for asking that question about how people can donate. It's through pillclarityfoundation.org. And we hope that, some right folks are listening and helping us out. But I'm very grateful. We've had donations of $1 from a patient because, they have that kind of integrity that they don't want that free service. So every penny matters.
I think y'all provide a tremendous resource that, in my mind, as a healthcare provider, someone who knows a fair amount about AGS, it's not duplicated. I mean, I could be wrong, but I don't know of another resource or center to turn to when patients ask this kind of question, or with providers who might ask me as a specialist, what's your opinion about this? I often refer them to y'all. As far as I know, that you're the game in town. Is there another place that is doing some of this similar?
No, we're the only ones. You're right. We're the only ones doing it in a central capacity. We're the only largest, central, most reliable platform out there. Of course, people can reach out to the pharmaceutical company, which we encourage as well. But that's when you have 20 meds, you're not going to reach out to all these companies when the average time for waiting is about 14 minutes, per medication. It's unreasonable. We also get calls from patients sometimes that they're in the ER. What do you do? It's very difficult, right? So those are near and dear to us, and we try and help where we can. But yeah, we are the only ones right now.
I read somewhere, or maybe it was a conversation that you and I had at some point about some of these inactive ingredients, and magnesium stearate was, I think, what I'm thinking of. And what I took away from either the reading or the conversation was that currently many of the manufacturers are using plant-based magnesium stearate because of cost. Is this true, or are there trends in the inactive ingredient profiles that you can speak to?
Yeah, to my knowledge, I don't believe that is necessarily true. But I want to commend at least one major pharmaceutical company that did tell us that we have defaulted to using plant-based magnesium stearate only, which I love.
Yeah,
Unfortunately,
that's huge.
unfortunately, all the patients don't know that because the package label only says magnesium stearate. But I think that was great when they said that. Then there are others that they themselves don't know what they are using because they keep switching between suppliers. So it's not necessarily their fault, but it's appropriate for them to do the due diligence and know, where the source is coming from. And then third, there is a type of company out there that will tell us, Dr. Shah, we need the lot number of the patient and the medication that they're consuming so we can check. I commend them as well because at least they are trying to do the right thing. But that process takes a long time. And I want to share an example of a patient. Just last week, they got a tick bite. They already have alpha-gal syndrome, and they were prescribed doxycycline. And they could not get the information in a timely manner, so they did not fill the medication and chose not to take the doxycycline. So now they're choosing to open their health up to a whole host of issues that could happen because of a tick bite. But because they didn't get this information in time, they did not take their doxycycline. So, the system needs to be cleaner and faster and more accurate so these type of situations don't happen. Now, when it comes to magnesium stearate, it is not that everybody is using plant-based. We have examples of where people are using animal source magnesium stearate. So that is very true.
It is terrible when folks have to pick and choose whether they're going to take a therapy or not because we don't have an answer, or because we're concerned about the potential. Sometimes the unknown uh, gets us perhaps more than if we just knew, well, it comes from a mammal and maybe we can pre-medicate and get you what you need. But sometimes sitting in that unknown space is the most difficult.
Agreed. And you remind me of a patient case that also happened recently, where a father is messaging us on a Friday night saying, "I need this information," and unfortunately, our pharmacists are not around on the weekend. And I was on and I'm looking and I'm like, "Can you wait?" And they're like, "No, my daughter is getting dental surgery. I need to have this right away." Or she's going to be in pain. She can't be in pain all weekend. So we got it done.
Wow.
But those are the reasons why we exist. Those are the reasons why when you ask where do you want to go and what's the growth, like I want to make sure that this service is 24/7. People can call us. They can call us from the ER, and there's not a gap in the access to care. So these are the reasons why we exist.
And y'all think about vaccines as well? Do you get asked about vaccinations?
We get asked about vaccines all the time. In fact, I'm working on a vaccine project right now, trying to reach out to every vaccine company and try and get an answer. And I'm hoping to submit this to the ACAAI group and see where it goes. But what I can tell you is there's not that many vaccine manufacturers out there, as you can very well imagine. There's 3 or 4 big ones, but out of those, 2 of them won't even give us the information. Okay. which makes no sense, and it needs deeper diving. But 2 of them won't give us the information, and it's unfortunate. For some of the other ones, they are giving the information. Some of them are doing a phenomenal job at giving us the information. But we are still seeing a few discrepancies where clarity is needed in their response. Okay. But the reason we navigate vaccines carefully is because we need that for public health reasons. And we don't want to create this massive campaign where people stay away from vaccines, where it may be manageable or they may not react even if there's a trace amount. So we want to be very thoughtful in the way we position this. And the way to be thoughtful is to get the information first, and then make some clinical decisions around it.
Yeah, absolutely. It makes me wonder if there is an opportunity for like a pill clarity certified line of therapies, whether it's personal care products or medications or vaccinations.
It seems like necessity is a word that I'm having using multiple times today. Unfortunately, since many of these companies are not giving us this answer, I'm having to resort to that. So yes, maybe we will do that. And I've got some things in play for that to happen, at least for the basic drugs like diphenhydramine, or any other antihistamines, etc. I want to put some basic products out there because it is so hard to get this information. So yes, we're on the same page, and I think that would be a net value to society as well.
Yeah. Can you speak a little bit about what an NDC number is? I as a physician, I have to admit, I would tell you off the cuff, well, that's how pharmacists speak to one another. But what is it, and what information does that particular number contain or identify?
So, an NDC is a unique, around 10 to 11 digit number that identifies a specific drug. But not just that. It will also identify the manufacturer. So there are 3 parts to it. One is the drug, the second is the manufacturer, and the third is the bottle type or the formulation type. So it kind of packs these 3 things. Think of it as a unique code, or when you buy a product like a QR code. And in this day and age, we should use the word QR code. Is like is a thing that identifies a particular product very specifically. So yeah, that's what an NDC is. Every prescription product will have one. So ideally, when people can check at the level of NDC, is the safest way to make sure.
Gotcha. So if you have let's say you're taking levothyroxine and you have the NDC that works for you in an alpha-gal scenario. Does that mean that you can count on that sort of, I don't like the word forever in this case, but would that mean that medication is now safe for you long term?
So now you're really getting into the deep end. And this is a very important patient safety question. So thank you for asking this. The answer is no. Suppliers change, and that's why the NDC number can be the same. The NDC number is tied to the active ingredient, let's say levothyroxine. Okay. The inactive ingredients will remain the same too, but the magnesium steroid supplier can change. Hence, the product may not be safe or necessarily safe. Okay. So if you really want to get on top of the NDC, you can check by lot number, which is kind of tying it to when the production of that specific drug happened. And now there's a lot number associated to it.
So I take from that it is legal for pharmaceutical manufacturers to change the source of the inactive ingredient, and there really isn't no one has to put up a flag to say we've changed this from plant to fish or plant to mammal, etc.
How it is manufactured and the source of it is less critical as the final ingredient. So they care about the final ingredient. The final ingredient could be polysorbate 80, polysorbate 60, which has a stearic acid component to it. Now, whether the stearic acid is coming from a plant or an animal or something else is a different problem. They care about the final ingredient that's on the label. That is still accurate. Okay. So it's like saying, hey, I am selling you a cake. That part is still accurate. Now, whether it's a, vegan cake or non-vegan cake, whether it has eggs or does not have eggs, changes. And that may not be the best analogy. So I would ask your team to cut that out because that means that the ingredients are changing. So the ingredients cannot change. The specific ingredients cannot change, but the source of the ingredients can change.
And they don't have to tell, right? Like, so lot to lot is, or if you have a lot number, then you know that if you tolerate it in whatever food allergy aspect, if you're tolerating a specific lot number, you can feel reassured that your sources are going to be the same.
Absolutely. So it's lot to lot, 100%. So if you get a lot that works for you, no problem, you can be assured by that. But the lot may not stay around on the shelf for too long. So if you're going back to the pharmacy and they're using a different lot number, that's a different scenario. Now, here's a fun example, and please, I'm not endorsing any company here. But here is a product, basic product, ibuprofen from CVS. Okay. And here's a basic product from Walgreens. Same product. Okay. And if I can position this right here, you can see that they have the same lot number. So you can have the same lot number for the same product, but then two different boxes are put on it for two different brands. So that can happen as well. So in that case, the answer is the same because it's produced on the same lot, right? So there's the branding problem. There is the NDC piece that needs to be thought through, that every NDC is not safe, but then, to be 100% sure, it has to be by lot number.
So those two products would have the same NDC number, the same lot number.
They would have a different NDC because remember, the NDC incorporates the manufacturer as well. So more than likely they would have a different NDC.
Wow.
Yeah, and this is over the counter products, but that is like a barcode is a better analogy. So the barcode is going to have to change depending on the brand.
And certainly one of the other areas where alpha-gal syndrome becomes a challenge is that some patients can be fine with certain exposures, whereas others might be quite sensitive. So you may see a lot of individual variation in their ability to tolerate certain exposures, which I think from a provider standpoint can kind of lead the non-specialist to sort of throw up their arms and say, I can't figure this out because the patient I had before with your same allergy was fine with their cetirizine, but now you're telling me you're not. And I assume you almost hear some of that on the receiving end at Pill Clarity as well.
We do. We do get a lot of that. It is frustrating. And it's also frustrating on the pharmacy side, because what happens is, as a provider, you do write the medication, and you're writing a generic medication. And what happens is the pharmacy can fill any manufacturer based on their purchasing, deal with whoever is giving them the medication. And as you know, we did a paper on this where we're talking about statins, right? And there are 40 different types of statin manufacturers in the US market, and you can write a prescription for atorvastatin, and now the pharmacy can give you any, and it could be having an animal component in it, or it could not. So then you could write, dispense as written, DAW1 on your prescription, and that makes sure that you're getting the exact product that the provider has written when you're doing that for a branded product, or when you're giving them a specific NDC. So my recommendation to providers would be, when possible, use the dispense as written when writing scripts, and when possible, write the exact NDC on the script itself. Now, that is not easy. You may not know the NDC, but that's where Pill Clarity has been providing these NDC numbers to providers, and then they just write it on the script. So that's a solution to ensure patient safety. The other part of this is insurance coverage. So now the patient goes to the pharmacy, but the insurance may not cover the specific product that they're eligible for, and they may only cover something else. So now the pharmacy is like, hey, we're losing money on this. You have to pay out of pocket. And that doesn't work either. So there's a viable solution, but insurance doesn't cover it, so the patient doesn't take it.
I would say that in no part of medical school training do I remember being informed or even suggested that we could, on the provider side, write an NDC number on a prescription. And so I think that's really valuable information, that if we have that and the patients come to us with the Pill Clarity investigated NDC numbers that are the preferred ones, that we can actually write that, and pharmacists will try to fill it.
Yeah, it's not required by law, of course, and that's why most people, 99.99%, it doesn't happen. But you can absolutely add that on there to be very sure, because you're now instructing the pharmacy that, hey, this is exactly what I need, and you're doing it for patient safety.
Yeah, absolutely. And thinking about patient safety, I wonder, how do y'all approach, the biologic landscape has really exploded, right? And many of these pharmaceutical manufacturers are using or may use a mammalian-based production cell line to drive their biologic. How do y'all approach that on the Pill Clarity side?
Great question. So vaccines and biologics are they're troubled children for us. So we talked a little bit about vaccines. When it comes to biologics, we recognize that some cell lines may be a greater problem than just any cell line. So I think giving people the information what cell line is being used is key. Mm-hmm. And then, since we don't know whether the glycosylation could be happening or not happening in the manufacturing process, and they're not lab testing for it, there is no way we would know. So we just have a ton of disclaimers that we're putting, saying, hey, look, here's the information, and then here are the disclaimers. They're not lab testing for it, et cetera, et cetera. Unfortunately, that's the best scenario right now until these companies start figuring out a test, which exists in that space, but it's not happening. That being said, I've seen scenarios where how the letter is written from the company side is important too, because we all know that we live in a TikTok generation and we want to get this information in a second. So if you open with, hey, there are no animal-derived components expected in the final product, people will stop there and then they won't read the rest. And then usually the information that may be of concern to them, maybe in the rest of the response. So we are working towards making sure that even the order of the standard response letter is patient forward, and that's why a united collaboration with pharma is the solution.
Yeah, absolutely. It, if you know this, in the new era of biosimilars, right, that where that's the basically the buzz phrase for a generic version of a biologic therapy. Um, are there the same requirements of biosimilars in terms of disclosing their production cell lines? Many of the branded biologics do some post-translational glycosylation analysis with mass spec. Is that required in a biosimilar sphere?
So it is not required to test for glycosylation, to my knowledge. But I do believe that I can't think of any examples where they've not disclosed the type of cell line that they're using. So that is good. And I think that makes essential sense because based on FDA regulations, you have to disclose every um, ingredient that is used in your product, not necessarily the source. And in this case, if you're using a cell line for development, you would have to put that in there.
Gotcha.
So that's kind of where my knowledge ends relative to biologics.
Well, no, I appreciate that. It's certainly an evolving field. We've got new biosimilars, we believe, coming in the allergy immunology space as well. So,
And one thing that I do want to mention is now there are plant-based vehicles to make biosimilars, and that is coming in about a year and a half.
wow.
Okay. Some of it is happening, but there's a couple of companies that one of them is making a Humira alternative. We're speaking to them as well. And I think that's going to be exciting, a lot safer, a lot cleaner. I've spoken to their scientists, and glycosylation of the alpha gal epitope is not a problem in there.
Yeah, that is exciting. Well, it's nice to have that heads up. Appreciate you
Yeah.
sharing a preview of that. Are there any common questions that Pill Clarity gets asked that you would want to talk about at this stage, where I'm thinking of vitamin D, maybe something that comes up pretty commonly that would perhaps save y'all an email or save the patient a query?
Yeah, so vitamin B12, vitamin D are two big ones. Of course, levothyroxine I mentioned is, for some reason one of our more popular ones. Antihistamines, as I mentioned, steroids. But from a common question, one that I do want to mention is like just basic: what is gelatin? What is magnesium stearate? Is glycerin a problem? Is polysorbate a problem? So we have started writing blog articles on just that type of topics, so that the number of inquiries and the general patient education goes up, the number of inquiries goes down, and then you're empowering patients to do their own research as well. But of course, we're happy to help. So one category of questions is understanding ingredients. The second category is just the frequent flyer medications, and they kind of have seasonal variation sometimes as well. So it varies quite a bit, and that can be brand, generic, including the GLP-1s. When they were hot, people wanted to know about that. Coincidentally, both the GLP-1s that are in the market right now are suitable for this patient population, but patients just don't know. So the company that discloses that information has something to gain there if they do it. So that's another area. The third thing I want to mention, which I think is valuable for providers, is we did an analysis saying, how common is this medication problem? So we took the large Facebook social media groups and analyzed every comment, over 1,000 comments, to see what are people talking about. And a big category, as you would imagine, was food, which was 20% of them. But medications was not far behind at about 19%. So actually, and this is just what they're discussing. So, people, eat more food than medications. So there's a volume issue there. But the fact that 19 and 20% were pretty close enough, tells you that there's a good number coming. And like I said, we are helping about 1,000 patients per month. And so the need is in the thousands as well.
Yeah, absolutely. Do you have a sense of, out of that 1,000, how many are based in the U.S. versus outside?
Oh, I would say 95% plus are, if not 99%, are US based.
Because some of the rules, I would imagine, volume expanders come to mind, where gelatin can be included in volume expanders, but those really are not in use in the U.S., but maybe in other spots.
Yeah, and I think that our presence in other countries is not entirely there yet, even though we are on the World Wide Web and people can find us and that's how they get to us. But I think the general awareness in other countries is not entirely there. But we have helped patients in Australia quite a few times that I can remember, and a few other countries. So yeah, you're spot on. But right now it's the US that is asking us these questions a decent amount.
What's your website address?
It's pillclarity.org.
Great. We will include a link to that as well.
Thank you.
Well, Sachin, appreciate your time today. Any final thoughts you might have, myths to bust?
I think we've made very clear that medications is a problem, because I've had very senior people that say to me that, oh no, medications is not a problem. And that's a myth. Medications is clearly a problem because we're helping thousands of people. And I've seen the people reacting to it on ReChallenge as well. Second is, we would assume that the drug manufacturer would get this information right 100% of the time. And that is not true. And that's a myth we need to bust, because there's an independent paper out there that compare DailyMed, which is the FDA's database of medical information, to the structured product label of each product out there for the top 100 products, and they found a discrepancy 39% of the time. And then we did our own analysis calling pharmaceutical companies, and 40% of the time we did not get an adequate answer. And then I mentioned the unpublished data of over 100 companies that we reached out to. 50% of the time we did not get an answer. So these three data points tell you that the manufacturer doesn't always get it right, and the message would be patients need to be their own advocate and do the due diligence as much as possible. But when possible, of course, we are there as a resource to help.
Well, we are incredibly grateful, not only for you, but for Pill Clarity as a resource. So thank you for all the incredible work that y'all are doing. It really is well received. And there is, as we discussed, there is no other resource like Pill Clarity, and patients have really benefited from the expertise and caring that y'all provide.
Thank you so much. The pleasure is ours, and we really hope that people continue to find this service beneficial.
Sachin Shah, thank you for joining me for Questions People Ask.
Thank you.
Resonate.